Does your jaw pop and click when you eat? Are you also getting headaches? Do you get like twitching in your eyes sometimes? Chances are you've probably been told you have TMJ, temporomandibular joint issues, which is the joint in the jaw. There's a lot of reasons for this. One of the reasons, the main reasons a lot of people don't know, is actually coming from your spine. So in the top of your spine, right around C1, C2, you have this neural pathway, a nucleus that controls a lot of the sensation and feeling and temperature changes in your mouth and around your neck. It's called the trigeminal nucleus. That nucleus actually controls C1, which is the top of your spine, right around your brainstem, and it controls the TMJ area. So what's happening, and I talk about it all the time, is the top of your nervous system, C1. It's responding to everything, emotional, mechanical, chemical, all different afferents and efferents, which means signal coming to and from the brain, are all going through that area, and it has to adjust every day to what we do. Now, most people probably, unfortunately, don't get their C1 adjusted. But what happens is over time that C1 gets lateralized. It starts to really pull out towards a certain side. And what you get eventually is, because there's so much irritation in the upper cervical spine, you'll start to get a sensation from that same nucleus where that now can no longer control what's going on in your jaw, and it'll start to send aberrant information to the jaw. And the jaw will now start to tighten in this area. You'll start clenching, right? A lot of people are like, oh, I didn't realize I'm clenching. You'll sit there throughout the day at the computer and you're like, oh, I'm clenching. That's because you have a disturbance in your central nervous system, or an emotional stress that has triggered a disturbance in your central nervous system. Remember, it doesn't always have to be a mechanical irritation in your nervous system that's messing you up. It could be emotional, it could be chemical, right? It can even be environmental, just temperature changes, right? You go outside, you start shivering in the cold. That's irritation. Your nervous system has to adjust to that. Your body has to send blood to your tissues to calm you down. That's all regulated by your brain, just like everything else in the body. The conventional methods for TMJ are, I've seen some pretty rough treatments involved. I've seen people get their teeth filed down. I've seen people get their jaw broken. And the problem doesn't go away because they haven't cleared out that central nervous system part of it. So what we do in chiropractic, certain chiropractors will clear out that upper cervical spine, and you can also adjust the jaw. Now, the TMJ has a disc in it that kind of starts popping out. And if you've ever chewed a bagel or a steak and your jaw's popping and clicking, that's not something you have to live with. It's not permanent. And if you file your teeth down, it's not going to correct that issue. Really, chiropractic is probably the quickest way to get your jaw back into the proper place. And you also have to correct the cervical spine. Now, a great adjunct, what I tell a lot of patients, is to go see their dentist and get a night guard. Aside from adjusting the jaw, a night guard is a very important part of it, right? Because when you're wearing a night guard at night, it's stopping your teeth from approximating. And when you're clenching your teeth, you really are putting a lot of pressure on that disc. That disc is going to eventually pop out one side. Whatever side is getting more aberrant nerve information to it, the jaw is going to be under a lot more stress on that side. It's going to pop out. A night guard is a very good preventative supportive device. So patients who do struggle with TMJ, I usually refer them to a dentist in the area or their existing dentist to get a guard made, because you do want to stop that. But if they just get the guard made and don't actually correct what's going on in the jaw or in the neck, they're still going to pop or click when they're awake. They're still going to be clenching. They're still going to be tight, and you're still going to end up with headaches. And you get these temporal headaches, right? It's headaches right in here, and it's like a tension headache. It's driving you crazy, and it'll start pulsing, and sometimes it'll become a migraine. I've seen some really bad TMJ issues, and a lot of people don't even know that's where it's coming from. So I want to talk about how it's always the nervous system you have to address. It's not just spinal issues that you're going to find. Another great treatment I do for my patients with TMJ issues is acupuncture. We'll get in, we'll put some needles in the jaw, we'll use a cold laser on the jaw. Acupuncture is a phenomenal way to calm down the muscle spasms, increase the blood supply to that area. And also with the acupuncture, you get a very relaxed patient afterwards. So when I'm doing a TMJ treatment on a patient, treating them for their jaw pain or for headaches, I treat the area of pain, but Chinese medicine is holistic. It's going through everything. So I'm also going to balance out their qi. We're going to get it flowing. We're going to balance them. We're going to do a lot of relaxation in a treatment on a patient with TMJ because they're hammering down. Another thing is called bruxism, where you actually grind the teeth and you start wearing your teeth down. That patient definitely needs a night guard at night. And that's definitely something a dentist would be able to help you with. So these are the ways to address TMJ. Don't get stuck in a situation where you're getting headaches, popping Tylenol every day. See a chiropractor who's capable of fixing your jaw. And if they fix your jaw, they gotta fix the neck, and vice versa. The signal goes both ways. So you could have a jaw problem that's putting your neck out, which makes sense. And you can also have a bad cervical spine that eventually your jaw locks up. So TMJ, it's a chiropractic thing just as much as a spine is a chiropractic thing. Thanks guys, be well. If you guys like this video, hit that like button. It feels good. Not as good as getting adjusted, but it'll feel real good to press on the like button. And if you have any questions, you can email info@greenwichwellness.com to see what it is going on with you. How can we fix your jaw? Can we fix your head? Can we make everything great for you? I hope so. But definitely subscribe in the meantime, and we look forward to hearing from you guys. Be well.